Hi everyone, thank you for coming today. My name is Alan. I'm very fortunate to have the opportunity to come and share a subject very close to my heart with you. As you can see, the subject is musicians' health. A little bit about my background. I'm currently doing my last year of medical school, and before I started my undergrad, I was also a violinist, hence why musicians' health means so much to me. So why exactly am I here? I want to address health concerns and fears that music students and musicians may have, as well as attempt to normalize the taboos associated with health issues and injuries. I also want to discuss what is currently known about musicians' health through literature and touch on a bit about our research at Schulich over the past 2 years. As we often do in healthcare, we have a clinical case. Meet Chelsea. Chelsea is a 21-year-old girl from Ontario. She is in her final year of piano performance at McGill. Over the past month, she has developed tingling in both her hands due to over-practicing for her final recital. Because of this, she has now become depressed and anxious since she is not able to practice as much as she would like. She is also running low on birth control. This may seem like a straightforward case, but there are a few obstacles. First, Chelsea is from Ontario. Is she covered while she is in Quebec by her provincial health insurance? Second, doctors often have a one-issue per visit policy. How does she address all her concerns? Last, should she be seeing a psychologist for her mental health concerns or the doctor? Unfortunately, for everyone, this is a case-by-case situation, but hopefully you can relate to Chelsea in one way or another. I titled this next section Doctor Translator because I want to attempt to translate some concerns and worries the general public has regarding going to the doctor. I also took the liberty to ask some of your colleagues sitting in the audience, as well as previous graduated musicians, about what they wish they knew when they were sitting in your chairs today. A question I often get asked is, when should I be seeking help? Or a similar question, how much is too much? What I mean by that is, how much pain is too much pain? How much sadness is too much sadness? What I often like to suggest is use some common sense. You should not be having so much pain that you can't sleep at night because you're over practicing during the day. Also, don't always trust Dr. Google. Dr. Google may be able to reassure you when you really should be going to the doctor, while Dr. Google may also freak you out needlessly. So a couple things to try. First off, listen to your body. You know your body best. You've been living with it for the past 20 years. No one knows your body better than you. You can also ask your fellow colleagues or instructors. Chances are they've been through what you're going through now and may have some suggestions. You can also try and make associations with previous injuries so that you don't make the same mistake twice. If you had this amount of pain before you ended up having to go to the hospital, then avoid practicing before you reach that threshold of pain. At the end of the day, from the perspective of a healthcare professional, it's always better safe than sorry. We much rather you come in before you get injured rather than after, and we much rather you come earlier on during your injury rather than later. One question I get asked is, why are doctors always late? Do doctors own watches? Well, I can tell you that doctors do own watches, very expensive ones, might I add. But it's important for you to understand in what context you're seeing the doctor. First off, are you seeing him in a walk-in clinic, or do you have an appointment? If you see a doctor in a walk-in clinic, expect some delay because it's not possible to predict what other patients are coming in and for what reason. Also, this also applies when you go to the emergency room. In the emergency room, you're seen by a triage nurse who sorts patients by their severity, and doctors will see patients who have more severe conditions first. So things you can try. First off, find yourself a family doctor. It doesn't matter which province you're from. You can have a family doctor in that province or in your hometown, but you could also have one here. I understand that it may be difficult, but the earlier you get yourself on the wait list, the earlier you will have a family doctor. If you believe that you have an urgent issue, you can call ahead to inform the doctor's office or the emergency room so they don't have to figure that out once you get there. If you have an issue that is less urgent, make an appointment for it so you don't have to wait for a whole afternoon in the clinic today when you can go and get an appointment and be seen at 2 o'clock sharp tomorrow. You could also try and ask for a time slot that has less delay. Now, this doesn't always apply to all clinics or doctors, but oftentimes these slots are the first in the morning or first right after lunch. If you arrive towards the end of the day, expect some delays from the patients in front of you. I often also get asked, well, how do you talk to doctors? Patients often feel like doctors don't understand where they're coming from, and that may be true. In this specific case, you have to understand that doctors might not always have a musical background. They might not understand how you were injured or how their proposed treatment might interfere with your practicing. Things you can try? First off, explain the whole story in context to your doctor to make sure that you and the doctor are on the same page. If you don't understand something, you can also ask the doctor to clarify. Just like in an orchestra, how musicians are responsible for following the conductor, you are also, as a patient, responsible for your own health and to advocate for it. So if you don't ask for clarification on something you don't understand, part of the responsibility then now falls on your own shoulders. I always like to remind patients that we've honestly heard it all before. Don't be afraid to disclose everything you're struggling with, not limited to whether it's something trivial or irrelevant, or maybe it may be mental health concerns such as anxiety or depression that you've previously discussed with a psychologist, or it might be also embarrassing issues such as sexual or private family problems. The more information you can offer your doctor, the better, because the more information they have to work with. So tell your doctor everything and let them decide what information is useful. The doctor said, "What?" Unfortunately, not all advice given by doctors are very practical. I say this not to belittle the doctors, but doctors don't always understand obstacles that the patient may go through. But keep in mind that doctors ultimately want what's best for each individual patient. So a couple of things you can try. First off, if you don't feel like you can fully follow through on a doctor's advice, tell him why. We call practicing medicine the art of practicing medicine, and that's because there are many ways to treat the same disease. So if you don't feel like you can follow through on one advice, there might be an alternative. Also, even if you feel like you can't complete every single advice that the doctor has given, you can at least do the best you can. Ultimately, completing 80% is still better than nothing at all. And remember that if the doctor asks whether you were able to complete all the advice, tell him what you were or were not able to do. So that's it. Patients often feel like doctors are rushing them out the door, and there really is no excuse for that. So if you've experienced this, on behalf of all healthcare professionals, I would like to apologize to you for that. But what happens if you're stuck in such a situation? Well, first off, before you go see the doctor, you can ask for a well-patient checkup. What that tells the doctor is you may have multiple issues or multiple things in your history you would like addressed. You could also try making an appointment for a 1-hour visit. Like I mentioned before, avoid going to walk-ins if all possible. If one issue was already addressed and you still have a couple more to go, you could arrange with the doctor for a follow-up, maybe the week after, so then you can come back and talk to the doctor whether the first issue has resolved. Also, don't be afraid to let the doctor know that you feel rushed. I understand that you've had previous lectures on healthy habits and lifestyles. Over the next two slides that I will quickly browse through, I have a couple pointers based on guidelines that Canada or the US have published regarding nutrition, sleep, and exercise, as well as alcohol and other drug use. Now, all the links to the guidelines are within the PowerPoint. I will share this PowerPoint with Dr. Boucher, so if you would like to consult the guidelines, you may do so at your own leisure. A common question I get asked is, should I be practicing right now? Well, over the weekend, I saw this graphic on social media that I found rather useful. First off, did you get a good night's sleep? Having enough rest allows you to remember your music and the fine motor skills that you're practicing. Did you eat? Practicing an instrument is physical, so you need the calories to do so. What about whether you've been outside over the past day? And no, it doesn't count if you're only walking from your house to the school and back. Or what about whether you've interacted with other individuals? Humans are social animals. We can't just live in a cage, or in this case, a practice room. If you pass all the checkpoints, great, congratulations, you can practice. But don't practice too much and make sure you take some breaks. Remember, there's always life outside of practicing. Lastly, know what resources are available to you. The list on the screen is by no means exhaustive. I've separated your possible resources into two categories. On the top are your allied healthcare professionals. That means you may encounter these individuals within a hospital setting. This category is most likely covered by your provincial health plan, which means on top of seeing the doctor, you can also see nurses and pharmacists for additional information. The second category of resources are often helpful for musicians as well. These are the massage therapists, acupuncturists, chiropractors, etc. You can consult your insurance company to see if you're covered. If so, take advantage of that. I've titled this next section, Time to Hit the Books. What that means is it's time for us to do some literature review. Well, you may ask me, why bother? We want to know what information is out there and can help us. In Chelsea's case, she might want to know why she's experiencing this tingling in her hands. In short, a literature review is just a fancy way of saying doing systematic research of prior literature and papers. Some goals you may have are trying to identify what we already know, what we don't know, how the field is evolving, in this case, the field of musicians' health. Maybe you want to look at past data, or if you're research-minded, you might want to design some new research to address questions. For the general public and musicians like yourself, you are able to complete the first three goals. As with any research, you always have to ask yourself, can I trust this? What are some trustworthy sources? Well, first off, government websites and well-known medical institutions identified by .gov or .edu are great resources. You could also go to credible journals, especially those with recent publications. You could also contact reputable individuals in the field, such as public speakers or writers of articles. What are some untrustworthy sources? One to note specifically is outdated publications. That's because, let's say, an article is 100 years old. The findings then might not apply to our situation today. Like I previously discussed, Dr. Google might not be the best place either. Wikipedia, blogs, media, or social media might introduce an inherent bias. Essentially, any sources that you might not want to cite on any type of paper might fall under untrustworthy sources. Before I jump into discussing what we know about musicians' health in literature, I want to discuss the difference between qualitative and quantitative research. Qualitative research is oftentimes more descriptive. It's asking how, why. The results are often in words or pictures. Oftentimes, they have a small sample size and they're not random. For example, qualitative research might ask, well, what color is the apple? Now, quantitative research, it tries to seek explanations or try and find causations. It asks questions such as what, when, or where. The data collected are often precise, measurable data in numbers. And the design is oftentimes very strict and controlled. The participants are random and there's a large sample size. An example of this may be how many grams does the apple weigh? Now that we know the difference between qualitative and quantitative research, what do we know about the literature on musicians' health? I took the liberty to do a search on PubMed, which is a government-owned website in the US hosting medically related journals. I found 52 relevant articles related to musicians' health, among which 38 of them were on physical health and injuries, and 11 of them were on mental health and concerns. If you're interested in this list, you can email me and I will be able to provide it to you. What we know from the literature is that there is an association between practicing music and physical injuries. The papers address very specific concerns. For example, close to 20 of them were addressing whether musicians are more prone to hearing loss. There's also debates among different papers. Some believe that musicians are more prone, others believe they are less prone. Many papers also only identify a problem and not a solution. And from what we know, literature has found physical exercise to prevent physical injuries among musicians, such as warming up your vocal cords before singing or stretching before you play the violin. But at the same time, they have also found practicing music a form of physical exercise. So what does that mean? Literature has also found intensive short-term dynamic psychotherapy, also known as ISTDP, may be helpful in certain medical health issues, such as anxiety, specifically moderate to severe anxiety. It has also found that physical and mental health issues in musicians are often intertwined, and you have to really address the root problem. For example, if you are suicidal, but the root problem is because you have low self-esteem, if you don't address the low self-esteem, the recurrence of the suicidality is often very high. Literature has also found a need for policy and research changes for healthcare, which is understandable because many healthcare professionals do not understand the needs of musicians. But it has also identified a need for change amongst educators and academic environments. What these changes may vary and they don't necessarily know. Now, having said all this, it's also important to remember that a lot of this research is qualitative and not quantitative. And in the scientific field of medicine, we often ask for findings to be quantitative, and that's a big problem in the field of musicians' health. For example, doctors want to know how many grams of aspirin to give a patient and not only whether to give aspirin or not. Let me take this opportunity to address the pink elephant in the room, which is the use of performance-enhancing drugs. On the slide, I've put the term beta blocker, but beta blockers are only one category of medication that can fall under performance-enhancing drugs. What we know from literature is that musicians often use these drugs without medical supervision. What that means is oftentimes they get this medication from their friends or the dealer down the street. But this can be very dangerous. In the case of beta blockers, this is because it can stop your heart if you have some pre-existing heart disease or if you take too much. Now, if you got this medication prescribed by a doctor, they would have first checked your heart to make sure that you didn't have any predisposing disease. But without any examination, it would be dangerous and risky for you to take. Now, what do we know from the literature regarding doctors' views on the use of performance-enhancing drugs? Well, some doctors feel that they shouldn't be for routine use at all. Others find that it's only useful for certain symptoms, such as tachycardia, meaning the racing heart, palpitations, meaning a pounding heart, and tremors, the shakes. While some doctors find that such medications are beneficial to a musician's performance, others also find that there is an associated increase in psychiatric outcome. So, what does that mean exactly? Well, what that tells you is doctors aren't even sure what the best suggestion is. Like with any medication, if you don't need to take it, don't take it. For example, your grandma might need medication for her heart. Well, you don't need to take it. So only take this medication if absolutely necessary. And if so, please go see a doctor to get a good checkup before using the medication. Regarding stress and anxiety, everything should be in moderation. You don't want to have too little because you would stay in bed and not practice at all. Nor do you want to have too much stress so that you would be exhausted or lead to burnout. What you want is to fall within this yellow category of optimum stress, where you have enough stress to function well. There's a professor at Juilliard who's written quite a bit on this, suggesting that you can use your optimum stress and turn it as a motivator to help you focus during performance. But what happens if there's no information available? When we look at any research, we always want to question, how does this impact me? In Chelsea's case, she might find no papers answering her question regarding why she's experiencing tingling in her hands. Or maybe when you're doing research, you might find that there are papers discussing anxiety and depression amongst professional musicians, but does this apply to you as a student musician? Or maybe you're more research oriented and you want to know how you can help move the field forward. If you remember back when we were discussing the goals of doing a literature review, they correspond with these three exact questions. Over the next two slides, I want to talk to you about the research we've been doing here at Schulich. As some of you may know, we have been going around surveying music students, trying to understand their health conditions and what they are most at risk for. I will try to tailor these results specifically to you, graduating musicians, as you transition from being a music student to professional musicians. Previous research and society as a whole had made assumptions that musicians are more prone to mental health issues. And this certainly is true in our findings as well. But what about music students? And what happens when you stop being a student? Is the academic environment actually helping or harming? On the right, we look at the level of depression by year of study. Surprisingly, we found the non-music students are far more likely to be depressed compared to the general public, suggesting that there is an academic environment contribution towards our findings. In fact, looking at our results from the first and second year music students, there might actually be a protective factor in studying music. But why do we see a trend where depression peaks during third year and drops again? Well, there are several possible reasons, such as students with depression dropping out. What is lacking in our research right now is data from upper year students, so we don't really know for sure whether the dip in the fourth and fifth years are truly there. From the data we do have, though, Interestingly, none of the fifth-year students, meaning the PhD and master's students, seem to have depression. Now this brings up several questions as well. With professional musicians at a higher rate of depression compared to the general public, does this rate just stay constant after graduation? If so, then we need to try and drop this rate for music students. Or is there truly a rise after leaving school, transitioning from post-secondary institution into professionalism? We don't really know, and these are questions that need to be investigated down the road. But as you transition into the next phase of your life, keep that in mind. Because whatever the mechanism that we have yet to clarify, you transitioning into becoming professional musicians are at a higher risk of depression and other physical and mental health injuries. So how much practicing is too much practicing? And how little is too little? Well, not practicing at all is probably too little, but our research focuses more on how much is too much. We know previous papers have linked physical injuries with practicing, but does how much you're practicing make a difference? And how about mental health outcomes and practicing? Well, I'll start with the mental health outcomes. We found very little difference between mental health outcomes and how much you practice. In fact, we found that most categories were quite comparable to the non-music students here at McGill, which, as I had previously discussed, was much more elevated than the general population, which tells us that likely there may be an academic institution contribution. And this is the same across anxiety and depression. But how about how much you practice? Well, it may come as no surprise that the more you practice, the more likely you are to be injured, and the less you practice, the less likely. As you can see on this yellow line, it trends upward. But if you try and extrapolate this yellow line to the level of injury for the professional musicians, then you would almost expect that professional musicians practice 12 or more than 15 hours a day. And as far as I know, most musicians do not do that, which begs the question, why are professional musicians at a much higher risk of physical injuries? Now, our research isn't designed to answer this question, so I won't try and attempt to come up with a definitive answer. But of course we can speculate. Maybe the way that professional musicians practice is different, or maybe they practice more intensely, or maybe the hours are more congregated together because of their work. It's difficult for us to know for sure, and of course we'll need additional research to tell us more. And we hope in the future we will be able to do research to help us answer this question. But what does this tell you as graduating musicians? Well, it should tell you that moving forward, even though we don't know why there is an increased risk of injury, that you are predisposed to having more injuries. So that you should be more cognizant when you're practicing. Maybe don't practice as much, or maybe remember to take some breaks before practicing. Or it might caution you that if you experience certain injuries, to go see the doctor before it gets exacerbated. Based on what we know about musicians' health in literature, as well as our research at Schulich over the past 2 years, now what? Well, first off, there's some questions that still need to be answered. For example, what changes during the transition from a student musician to a professional one? How can we make changes in the academic environment to address certain issues? Are our interventions for students and musicians useful? And why is music not a protective factor, or is it for musicians, like how the general public uses music therapy? But for you, there are also certain ways to apply it. For example, be cautious about how your practicing and lifestyle may contribute to injury. Speak with your colleagues and instructors and/or mentors. You're certainly not alone. As you can see, the prevalence of musicians' injuries is quite high. And learn to use your shortcomings as your strength, whether it's using it to motivate yourself or teaching it to future musicians so they don't encounter the same problem. So help us. I've discussed in previous slides how our research is lacking data from upper year students, and that's where you come in. The survey is available in both English and French and should take about 5 to 10 minutes to complete. The links are here on the screen and also available to you on my courses. Dr. Boucher has also graciously offered the survey as an alternative to the assignment this week. She will provide you with more information over email on how you can do so. In a week's time, I will also provide Dr. Boucher with the findings on your class, which she will email to you. Thank you for your attention. If you have any questions, feel free to email me at the email on the screen. Thank you.